So I'll ask Marianne and Nick to have a seat at the panel. This is the moment when you, the audience, get a chance to ask these distinguished speakers any question you want. And Russ, you can hear us, right?
Yep.
Okay, great. So I'll open this up to the floor if anyone has any questions. Okay.
So Russ mentioned the leverage that he lacks having a boutique set of data sets in the cloud. Is there anything that Strides could do to mitigate that?
Yeah, so if probably more easily if he's a part of Strides and if that program enrolls, but you'll get access to kind of the enterprise support. So this is their highest level of support. You can put in a ticket with Google or Amazon. You can tier it to say, this is mission critical. I want an answer within 15 minutes, or it's okay if I get an answer within a day. But that's part of becoming part of under the Strides agreement that we've negotiated. Is anyone who's part of it gets that high level of hand-holding from the companies that you may not have if you're just paying as you go with a direct relationship over a credit card or whatever model may be there. That's not to say we couldn't also lean if Russ and team weren't part of the Strides initiative. I think we have good relationships with Amazon and could say, today, hey, can you help out? They need to increase their capability or capacity on AWS Batch, and I think Amazon would perhaps with connections work it out internally on how they can expedite that.
Hi. So, Nick, I love what you're doing with Strides. It's come a long way really quickly. How are you getting the word out? I mean, I hear a lot. People, I get emails from friends who are like, who would you recommend, Google or AWS? We're trying to budget our grant. So is there a way you can build this into the grant ecosystem so that as people are getting their grants together, that every program officer at NIH says, go to this page first?
That's a great question and something we're actively working on. I was at the Federal Demonstration Project talking about Strides yesterday on how to make sure the funding agencies and our partners can understand how to leverage this. So a couple ways that we're getting the word out is the website that I mentioned. We're putting out new content, try to do it monthly with any updates. Some of this does have kind of grants and award policy implications. So we're working with our Office of, I guess it's the extramural policy, it's called OPERA at NIH, for how do we make sure people understand how to account for this, and sometimes there's direct and indirect cost considerations that need to be clarified. But I think mostly it's suggestions like this, putting it out in FOAs to say Strides is a resource that you can leverage if you want to do it. Here's where you go. Here's a website, and then talking internally and at other meetings so that our program officers and anyone who's getting those questions at NIH can route them in the right way, or hopefully over time answer questions directly as opposed to kind of coming through our central group.
Yeah, I'm interested in Strides and how you're handling the compute part and the compute costs, because the storage is very easy to centralize. The compute, sometimes you'll have people who spin up GPU clusters and leave them up for 2 months and incur a $40,000 cost, which has happened at J&J.
Actually, can I ask you anything just to facilitate us getting to know each other? Can people announce who they are and where they're from when they ask their questions, just so we can get a better sense of who they are?
Sure. I'm Gail Wittenberg from Janssen Research.
Nick Weber from NIH. Great question. So compute costs are much more variable. There are peaks and valleys, and that's where you can kind of get more runaway costs. If somebody puts an extra zero on the number of instances they're spinning up, that can have some large cost implications, rather. So compute, generally what we're seeing is people kind of either plan for it in two ways. There's either the owner of the data pays, or you can set it up so that if people are coming and accessing that data, the requester of the data pays. And both Amazon and Google have this capability. It's kind of binary. It's pretty hard to kind of come in and have some logic around it to say, well, if you're this kind of person or doing this sort of work, we'll pay for it. But if you're doing a certain threshold higher than what we're willing to pay for, you'll pay for it. So some software systems in the middle can help with that. But I think to I won't say prevent, but to help mitigate against that are a couple things. One is the requester pays on things where whoever's going to come and do it. If they mess it up, that's on them. That's on their dime, not the central research program. Another one is having billing alerts and notifications. You can do that within the systems relatively easily so that people get notified when you hit certain spending thresholds. And what we're doing internally at NIH to really prevent against that, because it's really troublesome in government. It's anti-deficient, if you're familiar with that legislation, to spend money that we don't have. We're putting in some additional protections with some third-party software tools that actually are able to kind of go in and shut down resources when it goes past a certain level. That may be heavy-handed for R&D sorts of environments. You may not want to do that, but in some of our spaces, we're doing exactly that because we cannot spend more than what we have allocated to a given project or program.
So Nick, Russ Foldrack here. One issue that's come up in a lot of discussions recently, and I'm interested to hear if you guys are thinking about this, is there's a whole set of there's a kind of person that one really needs to do this work well, which is really sort of like a cloud research software engineer, right? And that sort of relates to the cost of, like, it's really easy to do things that can like blow out your costs, but these people are, one, hard to find, and two, in general, really hard to sustain in academia. I mean, Chris Goralewski left my group to move to Google because he didn't find a place in academia. Nobody, no particular department views him as one of them, right? And so have you guys had conversations at all about like finding homes and sort of sustaining the kind of research software engineer talent that we need for this?
Yeah, that's a great point. We have, and we're having the same struggles on my team, finding cloud support engineers. We often use like the DevOps or DevSecOps, if that's familiar to people. So development, operations, and security as key components within that. And finding people with those skill sets, they're like unicorns, and they're also really hard to retain when you find a unicorn. So so we've been trying to do this through our Office of Data Science strategy. There are some programs that are recruiting in people from outside of government to come in for short periods of time, maybe a year or two, with the expectation that they're going to leave. So if we know they're going to leave anyway, let's try to recruit them in, give them some insight, access to data, other things that they might find really interesting. Try to get that insight internally to train the rest of our staff and get the kind of baseline level up. But I don't think we have a silver bullet solution for how we in the government, who also can't pay very much to people, can retain when Google or Amazon can hire them away for twice their salary and many more benefits. So it's a hard nut to crack for sure, but we're trying to be consistent in putting the mission of what we're trying to do and the value of what somebody can, the experience that they can have and impact that they can have front and center to hopefully get them in the door, and then it's just a matter of time, usually, until the really good ones find another home. So.
Marianne, you have a comment on that? Oh.
Actually, I wanted.
There we go, sorry. I wanted to follow up actually on kind of a combination from something that Marianne and Russell said. So Russ gave a really interesting example of how the community came together to develop the BIDS format and the community standards. But for many of the uses to which we want to put data, it's not going to be enough just to have that standard for the core data, but for all this sort of phenotypic and other data. And you mentioned that as part of ICNF, and I just wondered if you could say a little bit about how much progress is happening there and with like common data elements and those sorts of things.
So I think there was a large investment in actually creating a lot of these types of standards. They've come up over the years. What hasn't happened is that a lot of them have been piloted, tested, and validated. And we're looking for those types of examples before we say to people, it is worth investing a lot of time and energy to actually trying to build a large project around it. So, you need to know that these things have gone through some testing. And so what we find, and this is, I just think, one of the things that has to be understood, that the standards and best practices will always be in flux. So you may write your software against BIDS 1, and then all of a sudden BIDS 2 tears the whole thing down, and it's completely different. And I think we have to understand what these timeframes are over when, we need some early adopters to say, yes, this thing is working. But then you're going to have to stand back a little bit and say, hey, you know what, for right now, this is the only part of this that we can support, because if we invest a whole lot of time and energy in doing this, is it going to be here in 2 or 3 years? And I don't think because neuroscientists, infrastructure providers, or anybody else has ever had to actually work through this, that there's a lot of experience in the community either about what it means to use a standard, because the very first thing they'll do is change it and adapt it to what it is that they need to do. There was a report that I think came out of the European Union somewhere that says research, however, requires a delicate touch with standards because it is research. So the idea that you're always going to be able to use the same file format, or that you're not going to be able to extend something because it fits everything that you're doing is false. So I think what has to happen is that we have to start to learn and monitor how far you can deviate from a standard before you may as well not have one, and get used to the fact that almost all of these standards have a core which will work for a large number of use cases. And it's really in the extensions and the edges that it becomes necessary to modify them. So I think if we take a practical point of view that says, you know what, you're going to have to use the core, and you're not allowed to modify the core, because if you do, then all the software, everything gets thrown out. However, every research group has the option to constantly change, extend, and do things at that outer edge of the onion, where it tends to be a much more rapidly evolving experimental landscape. But I actually think this is training and mindset. And I think BIDS is a good example, because at some point the researchers will say, well, that's interesting. If I don't modify this, I get all the way through. If I start to mess with it, then I'm going to have to go back and do it all over again. But BIDS is flexible enough that if you stick to those core things, which are pretty constant, right? Here's my subject, here's this. Then you start to realize how you can reasonably work with these standards such that you can kind of achieve both. Research isn't squashed by forcing everything to fit into one model, which it clearly won't, but yet we harmonize where we can harmonize and then extend where we need to extend. So that's kind of why I was saying that I feel that scientific infrastructure is a little different than the way that you would do it if you were purely clinical or purely industrial, where perhaps the standards are a little bit more rigid. Here they can't be rigid. And I think this is something we just have to learn how to do. And that's one of the things I think having an organization like INCF, which can monitor these implementations and begin to say, well, when does it start to deviate so much that this is really no longer BIDS?
So, question in the back.
Hi, I'm Lisa Merck from University of Florida. I'm a clinical trialist. I have a question for Nick. What types of initiatives exist at NIH to support adequate data curation from prospective clinical, multi-center clinical trial work, whether it's multiparametric data or imaging data, in order to allow for future universal access across the cloud platform? So curating those data in real time.
Yeah, so I may defer to a few of my colleagues in the room at NIH who may have more direct insight onto that, but I know that as part of the strategic plan for data science, there are not only 5 of those pillars that you saw, the goals. There are, I think, 18 or 19 objectives in there, and there's a working group on data curation, metadata standards, specifically, I believe, for clinical data. And I know there's a lot of work going on using the FHIR standard at NIH, and a lot of incentive for people to kind of use some standards across research programs and consortia. But that's about as much as I know in that specific area. There may be others who can chime in to provide more.
Yeah, this is Mike Herta from NLM, and there is increasing understanding across NIH that activities that are needed to make data fair are reasonable to put on your budget. So that's one answer. I think that's an important answer. One of the things my office is involved in doing is looking at NIH staff training so that program officers who don't have portfolios that are dedicated to computational biology will understand some of these concepts when they're looking at budgets and proposals. The other thing is Nick mentioned that we're looking at the FHIR standard, Fast Healthcare Interoperability Resources, I think is what it stands for. Teresa Zayas-Caban from my office is working to accelerate the promotion and adoption of FHIR across NIH. And you'll see some, in fact, I think we've got some notices out on that already, and we're actually starting some funding initiatives there. So FHIR is going to be a big thing for clinical data especially. Mm-hmm.
So it's really apparent from your talks
Can you
that a lot of...
introduce yourself? Sorry.
Oh, I'm sorry. This is Jonathan Cohen from Princeton University. I'm a neuroscientist. It's clear from the talks that there's a lot of work that's already been going on with exactly the goals that this workshop was intended to address. My question to all of you is, what do you see we can do today to help advance this cause?
I'll chime in first. So I think, so Marianne, I think you listed the STRIDES website, right? Our data science website. So getting more collection of resources and what these things that are going on, it doesn't have to be there, but in some sort of central clearinghouse, so that if you're in a different community than neuroscience or within neuroscience, there's pointers to where these resources and the standards and best practices lie. So having some more collation of that information specific to neuroscience, I'm happy to kind of put a little section on to say, if you're doing neuroscience in the cloud, here's some resources that you may want to know if people happen upon that website. So that's one thing. Additionally, in the trainings that we want to be able to start to roll out much more broadly, having specific content or specific trainings for this community or for domain specific, I think is a real opportunity. So as soon as I heard the Brain Summit in 2020, I said, how can we get Google and Amazon trainers in there? How can we make sure that that's purpose built for neuroscience, for deep learning on imaging, or who knows what, so we could prep for that to make sure it's really applicable to the neuroinformaticians and others who will be heading to that summit. So I think there's a few opportunities from my perspective that we could connect.
So I think in terms of today at this workshop, in my experience, having kind of gone out into the wider world and away from neuroscience a while, I've found that neuroscience tends to be a fairly insular domain. I think it's big enough that it can be insular in its own way, but that there are these broader initiatives that are out there. There's a lot of work that has already gone on this, and making sure that that can be brought in, and the expertise, the wisdom that have been learned through very hard knocks, I would say, about what it is that would work. But I break this up in my sort of fair partnership to really say there's the infrastructure providers who again, I think need support in their jobs. But then we have to at some point get to the researchers. And I think the researchers, what we're being asked to do here with these large open pools, yes, there's skills that we need, but there's also a mindset, again, that the data that they are producing is going to be reused at some point, or at least collected in a way where it can be reused. That's going to impose burdens in data management and other things, and yet the few studies that have started to come out about data management practices in neuroscience, I know of one on neuroimaging, suggests that even in neuroimaging, which has a lot of infrastructure, there's virtually no use of it whatsoever. There's no use of metadata standards inside the laboratory. There's not even awareness that such things exist. So I do think that there's large swaths of areas where we have to start thinking strategically about how we're going to feed the pipelines to be able to make sure that neuroscientists understand that something is expected of them here. The other thing I think of, and you heard this in Russ talks all the time, I downloaded the data, they downloaded the data. I have heard this from various groups. We're putting things in the cloud, but people are still downloading the data, okay? And that's happening a lot. So clearly, there's a mismatch between this idea that there are some opportunities here on how one works inside of the cloud versus the traditional way that we've done things. And I think that's another area here to sort of think about, right? I don't have to download the data anymore. The data are actually getting too big, and I shouldn't be downloading the data. I shouldn't be making multiple copies of this everywhere, because that also allows drift to happen, right? I now can modify these data sets, and maybe we're impacting interoperability. So I think at least what I would like to see here is, again, recognize that the research community is going to be asked to do something. There's skills that they need, there's recognition, making sure that if these resources exist, INCF and STRIDES, that they're supported by neuroscience and recognized by neuroscience, that there are places that one can go and work through to try to understand this. So that's what I would see as two possible outcomes here.
Story.
So this is Story, used to be at NIH. I think taking advantage of professional societies, many of whom have as part of their mandate training. So Society for Neuroscience would be a great place to run training, and it's probably too late for this year's meeting, but looking forward, whoever has access to the council to think about proposing those kinds of classes. And also for human neuroimaging, I don't know which would be the right meeting for that, but advertising the availability of this for NIH funding and education of whatever is the appropriate level. So societies want to keep their members up to date, want to provide things that members want, and this strikes me as something that would be top of the list.
Seems, oh, no, got to put the microphone on.
Okay. It's okay. Okay. So I'm Janaína Mourão Miranda from University College London. My question is for all the speakers: is if there are already examples of how the cloud computing has promoted collaboration across the studies. So, like two big institutions who were doing similar type of studies, just because both are using the cloud, so they can use the facilities for replication or putting the data together for machine learning and things like that. So are there already examples of people who are using the cloud, using this opportunity to combine across studies?
So should we take that from the speakers or from the audience? We have an audience member who
Russ
wants
here.
to-
Sorry, let me.
Go ahead, Ross.
Let me just add, hi. So this is not so much a story about commercial cloud, but about, more like academic cloud. So, we, having come from Texas, I still do a lot of work with the Texas Advanced Computing Center, and that's what you might think of as like an academic cloud resource where, we've ended up collaborating with other teams, having them, kind of bring data onto that same resource, and then using the compute there to do science, not on a huge scale, but certainly that's been, one really good example of, and because it's in an academic setting, we don't have all of the kind of cost issues around using commercial cloud.
Okay, so let's see, we're starting to run low on time, and Magali, you've had your hand up the whole time.
Magali Hosko in Veterans Bioscience. My question was for you, Nick. Governance. So I've heard a number of different approaches mentioned in these talks today, open models, authentication models. What is the approach that Strides is taking, and how do you think about the more open models as well?
Yeah, so that's an important question. So we want to make sure that data that should be open are as open and accessible as possible. So I think making sure people understand how to structure their data, make it accessible, but also make sure that the cost considerations for who's coming and using that doesn't always necessarily fall on whoever's putting the data out there, because that can be problematic. So we are taking advantage of, just like others, or helping to promote research programs, put data on the AWS Open Dataset program. You saw that as well, where AWS will kind of get some benefits from providing broadly open data sets to the public and make that accessible in other means. In terms of how we ensure proper authentication and authorization for users, there's actually a pilot going on with NIH right now with multiple academic and commercial partners to ensure that we're coming at consistent ways to authenticate and authorize users to data sets. So, for example, they'll bring their home institution credentials, and we'll have federated identities so that if you're at the University of California system, you come and you log in with those credentials, and we know who you are. And then we're connecting some of our data coordinating, our data access committee information on any controlled access data to make sure that's all accessible in a central repository that these resources can query over APIs to kind of say, okay, I know who this user is. What are they able to have access to? Okay, that's good. We can pass them through and they can get access to this sensitive data. So that's all work that's going on, again, under the auspices of our Office of Data Science Strategy. But there's a kind of a one-year MVP, a minimum viable product that's underway to start to coalesce around some of the capabilities and technologies, passing information around in certain standards that are common over the internet for how we do this and how we translate information on who somebody is, what they're allowed to have access to, what we trust about, what we know and trust about them, because that's critically important for making sure we maintain proper access to data, both for broadly public access data, but especially for our controlled access data.
How are we doing on time?
We've actually got a little bit of time.
Okay.
Another 5 minutes.
Okay.
I just want to go back to the request for some examples. For me, what inspired the idea for this meeting was an experience I had with my colleague over here, Bill Hansen, who is at Penn. I'm at Princeton. We were developing some methods for putting real-time imaging analysis of fMRI data on the cloud, something that's hard to do technically, and if we can get it on the cloud and make it easy to run, then it will be much more accessible to many more facilities that don't have the expertise to do it locally. We approached Penn because we were interested in doing a clinical trial with something that we had worked out in the basic lab. Bill was kind enough to put us in contact with some clinicians at Penn. The scientists were ready to go, the computer support people were ready to go, and the administrators put a big brake on it. It took 6 months after we were ready to go to get this thing off the ground. Why? Because there were no standards. There was no place they could look. There was no place we could point them to that said, here's how you do it. This is what's safe so that you can sign off on it and don't worry about privacy. You know, all the obvious issues that I think we're here to discuss today. After those 6 months, we were able to get it running, and the study has been going incredibly well, and I think it's something we just could not have done otherwise. So I think it's a great example of where cloud computing can make things happen that weren't possible otherwise, but we've got to solve this logistical problem.
So sort of a legal problem or compliance problem.
Well, as they say in FAIR, right, legal uncertainty interferes with reuse, and institutions with institutions now with things like GDPR and other things coming down where there are huge liabilities. We understand, we're talking to people from SDSC, this whole idea of data liability is a huge legal area that could have the unintended consequences of clamping down on everything that we've done. And we've already seen some of that in Europe where some institutions are interpreting GDPR as I better not let anything go out because I cannot afford the fines that they're going to levy on us. So I do think this is an area which again is underserved, but it's huge and it's coming. And the research institutions don't necessarily have the legal consoles because, again, this is a new area, it tends to be very expensive. Companies are spending huge amounts of money on this in order to say, how do we navigate this? But legal uncertainty, I think that's a quote by Michael Conlon, interferes with productive reuse of data.
Sean?
So I did just want to highlight one example that INCF was actually, or continues to be involved in, which is Center TBI, which is a large-scale traumatic brain injury consortium, which is using the cloud to integrate data from 22 different countries, hundreds of sites. It's an observational traumatic brain injury study. It's using Amazon infrastructure as well as commercial cloud for different brain imaging repositories. But what that enabled was rapidly expanding that study to China, to India, using exactly the same infrastructure and having all of that in an integrated representation.
I wanted to echo that we're using, oh, sorry, Jessica, that's right, Jessica Turner from Georgia State University. Hi, Sean. I wanted to echo that because our coins infrastructure that I'll be talking about later in the panel uses AWS, and for that reason we're able to interact with data sets in China because they're like, I don't know who GSU is, but I know who Amazon is, you know, and we know what they can do. If I could also add about training, it's actually not too late for SFN this year because David Kennedy's reproducible neuroimaging efforts, the ReproNIM, is having a training right before SFN in Chicago this year on reproducible neuroimaging and their pipelines and how to actually keep track of things, document everything, use reproducible code, and their computational pipeline for the cloud, I believe. So that is an option. If you're going to be at SFN anyway and want to learn about reproducible neuroimaging, I would definitely check that out.
So I think also the neuroinformatics meeting this year is going to be in Seattle in the fall, and that's another really good opportunity. To kind of get to the at least one of the themes of this session, I'm wondering again, is it proper to say the cloud or a cloud, first of all, because we know cross-cloud compatibility is not great. A thing that I had buried in, a risk that I had buried in, and again, a place where I think this particular group could help, talking about the legal aspects of it, is AWS dominates clouds for academia, as I understand it. And that also makes us a little bit nervous, or it should make us a little bit nervous, given the amount that we're investing in these commercial clouds. The situation is not exactly analogous to what happened in publishing, because we're not transferring our copyright for our data over like we transferred our copyright of our articles. But I do think that this is an area where a lot of people are fairly nervous of saying, well, what are the ramifications here, especially if a monopoly is established. I think NIH has that in their contracts about what actually happens. But as we're seeing inside the university, getting these commercial services for core areas of the way that academics work provides its own difficulties, because you can't just take data from Amazon and go plop it into Google, as I understand. I had a little snippet up there that said when HP took their cloud down, what happens to all that data? So I do think this is another area that in the area of regulation where we're saying there's tremendous benefits of this, and we can go across these clouds, we can do all of this, but there's also risk that I think needs to be understood.
So if I can paraphrase Jonathan's point, Jane Roscombe's, what we could help move towards developing is a readable, accessible roadmap for either Bill or you to be able to enter the foray. And we don't have that necessarily right now. We have it if there are people at our own institution who've already done this kind of thing. But if we were to begin to put our heads together and begin to develop such a thing, individual projects, like I see Randall over there, have some of those for their own platforms. But if we were to work with potentially the Strides people and the NLM people to be able to have the place where people go to see when they can pass go, or what they might need to do to have additional administrative oversight over clinical data, and who's done that already, and what did they have to do? You bet, including case studies.
Successful case studies.
You bet. If we could collectively begin to do that, would that have helped you avoid that 6-month delay?
I think that's exactly the sort of thing, though I wouldn't necessarily restrict it to just case studies or the need to have a specific, laid out roadmap, as I think has made the point. There's just so many different cases. But I think best practices that are specific enough to be able to show to an administrator, but general enough to be able to show to many different administrators would be great. I mean, a white paper that came out of this meeting that said, here's the sort of the collected wisdom of these experts representing sort of all factions and perspectives on it. This is what we think makes sense. I think would have assuaged, Bill's people. You can speak to that.
Yeah. So Bill Hansen from Penn. I'm the other half of John's partnership. So the administrator story is an easy one to point at, but really there were issues with understanding what this might do. There were issues with our IT shop. Who do we work with? How do we navigate this? And we're working with actually Microsoft Cloud. And there were a number of things that had to be navigated with the IRB, with the lawyers, with the IT shop. And it took time and patience. And at the end of the day, everybody felt like they had an oar in the water. And at this point, people are taking credit for the work that they've done to make that work. Now, to point out what's obvious here, Princeton does not have a medical center. Penn does. We have collaborators that are able to work together at the academic level. We have an IRB that sanctions the IRB endorsements of the other institutions. So there are a lot of things that helped out, but taking advantage of each other's strengths was very important in this.
And if we had IT solutions and ethics/IRB solutions that had already been generated for the same kinds of data sets in other places, it would be easier for our own IRBs to be able to re-review or perhaps even change the way they deal with other people's open data, correct?
Absolutely. Absolutely. They're looking for predicates that make them, feel like they're safe.
Okay, great. I think we'll leave it there and we'll continue the conversation throughout the day. Thanks. Thanks to the speakers.